Governor, on the travel restrictions, a couple questions, and sorry if I missed this. For people who are driving in, either from another state or returning to Rhode Island, I guess if you're coming from another state, who would ask to see the proof? And then if you're coming back to Rhode Island and take a test, who would then days later ask to see the proof that you've tested negative?
Good question. So as I think I said, this is a tough one to enforce, and I'll be the first to admit that it's going to be imperfect. So if you're renting a property, we're going to ask the rental agency to help us enforce this. If you traveled for work, we're going to ask your employer to help us enforce this, and we're going to be doing a lot of outreach now. But then some amount of people, it's going to be the honor system. So we're going to do a lot on awareness, highway signage and the like, but we're not going to be doing stopping cars with out-of-state plates, stopping folks at rest stops. We're just going to do our best on enforcement.
And if I could just follow up on that, would you allow people coming from other states to get tested here when they come here?
Yes.
So they could do that as well?
Yes. And in fact, yes. We don't want to punish anyone. We just want to make sure that everyone's negative. So if we know for sure they're negative, then they don't have to be quarantined. And so the short answer is yes, but we're also trying to make, I'd like to get us to a place where this is actually a reason people want to visit Rhode Island. So maybe we could do testing in an airport. Maybe we could provide easy, rapid testing for people. We're working on that right now.
Would you want kids to get tested who are visiting as well? So if people are traveling with young children, would you want kids? And just one more thing, I've been asked also about international travel from places that are not seeing high cases. Would that be back on the table at some point?
The answer to kids is yes, and international travel is not yet on the table.
While we're talking about testing, Governor, you mentioned you're going to add a fifth metric on test number. What number threshold? And if you don't know yet, what are you thinking?
Yeah, I'm going to let the doctor answer that. I'll tell you now, we don't know yet. But the reason I didn't come out with it today is because we haven't quite settled on it. So we're still talking about it.
Yeah, and to add to the previous question as well about testing, we still want to encourage staying local, monitoring yourself for symptoms. The test option is an exception that's in place, but we still want people, Rhode Islanders and visitors, to understand the value of monitoring for symptoms and being able to stay local. In terms of the type of lead measure that we would be looking for, we are assessing that. We're going to actually do a more thorough analysis of the other states across the country who have seen problems and make sure that we have a clear understanding of what early warning signs from a data standpoint they saw that will help us inform the best lead measure pertaining cases that we can use. Because we are doing such a good job now with testing, we can rely on that confidently. And I'm sure we'll also take into account where we are seeing spikes and clusters as a way to help us guide. Is it just those who are 20 to 29 and seeing what the cases are there in terms of their disproportionate increase? Or do we want to keep an array of early warning signals to help guide us in terms of cases?
Just one other thing on the testing, Governor. I remember you said a very ambitious, you want to be doing like 10,000 tests a day, you said in July earlier. I don't think we're getting close to, I think we're 4,000 on big days. I haven't looked at today's data on that yet. Would you still like to see that, or has your sort of goalpost for testing changed on what you want to see?
Yeah, awesome question. So our capacity now is just over 5,000. So we have more capacity than we are testing, which is why I'm up here every other day saying, please go get tested, please go get tested. I would love it if another 1,000 people every day got tested. And again, that's also, I think it's a competitive advantage that Rhode Island has, so I want to figure out how to best use it. We're not going to, we are not going to get to 10,000 a day in July, so maybe that was too aggressive. But we are gearing up for a big jump for get back to school. So it's not out of the question at all that in like late August, we'd be 10 to 15,000, because what we're working on now vigorously is figuring out what's a testing protocol to get everybody back to school, which is colleges as well as K through 12. So there's, so I'd say more to say on that, but we're still going to ramp. We're still ramping.
Governor, there's 23 states right now that if they come into Rhode Island, they need to quarantine for 14 days. How do we compare to Massachusetts? I'm just thinking of someone in Florida. You want to get out of Florida. I'm going to go to Newport or I'm going to go to Cape Cod. How do we match up with Mass?
Well, they should come here because we have better beaches and better food. I mean, I think we're doing better than Massachusetts. Is that?
I mean, if you go to Mass, do you have to quarantine for 14
Oh,
days?
sorry. That I don't know. Let me say this. I talked to Governor Baker a week ago. He's considering doing this. And I know, obviously, New York, New Jersey, and Connecticut have done this. I don't believe he's yet made an announcement, but I don't know.
And a fear is, within these 23 states, for instance, if you're in Florida or Texas, you want to get out of there, and Rhode Island seems a pretty desirable place right now.
I know. And that's a problem if you're positive. So if you want to come here, fine. Make sure you're negative before you come. Or if you can't do that for your first 14 days, quarantine. As she just said, stay close to home. Stay with the people you came with. Stay here. Listen, it's fine. We want to be a refuge because we're a safe place. But we can't. We know how, like the data is so clear on this that outbreaks all around the world often start from one person traveling to someplace. You saw that there was something, I think it was in the New York Times about a month ago. It showed how all the people that left New York City when it was a hotspot and traveled and started mini hotspots. So listen, come here, but either get yourself tested to be negative or quarantine.
Do we have effective testing in Newport? I mean, you have those new hotels. That's a place that would certainly attract people from the outside.
The answer is yes, but I want to do more. That's exactly where I want to go next. And I think it could be a selling point for Rhode Island. Come here and safely vacation. Come here, get yourself tested, and know that this is a place with a 4% test positive place. Not Texas, which is 14%. So that's where we want to get.
Governor, we have 23 states now who meet that criteria, the 5%. Are you going to be posting the rates of other states so that folks here know if they travel there, they're in a place where they're quarantined, or vice versa? How is that going to happen? How is that information?
So as I said, Johns Hopkins is doing a great job of keeping this up to date. You could go on their website, but we're going to put it on our website. It's constantly evolving, and we're going to update that once a week on the Department of Health. So at any given time, if you want to know what's going on in every other state in America and which of the states that are above 5%, go to the Department of Health website, and there's a list.
And before last week, you were considering doing a county-by-county one. Why did you decide? Was that impractical? Or?
So a week ago, we were, I thought what you were going to ask me was I was considering 10% as the threshold, and we decided to go 5% out of an abundance of caution. And we decided to, honestly, to do the state because it's the most easily available data, right? Like some of this is just enforcement. So this is a nice chart. We can put it up every week. It's easy for people to follow.
And then one other thing on that. Last week, when we first saw the real surge in other places of the country, you admitted we weren't quite certain exactly what we were seeing and why across the country. Are you confident now that it is the bars, it is partying that has caused it, or is there still uncertainty as we move to phase 3? What's happening in a state like California that does actually have pretty strict rules around COVID?
Confident is a strong word. So we've spent a lot of time looking at other people's data. I've been talking to governors. Stefan's been talking to his commerce colleagues. Dr. Alexander Scott's been talking to her. We're talking to everyone we can. What is really going on in your state? Although there's no certainty, if you talk to the folks in Arizona, they'll tell you that they did have large-scale protests, very low mask wearing, and 3 weeks later, spikes. Same thing in Texas with Memorial Day. County by county, you are seeing issues with bars. So I don't think any of this is I think, listen, I don't believe in like of the false sense of precision, but they do have, as we have, contact tracing systems set up. And they have a pretty good handle on how many people are sick now and what instance were they related to. And they believe that they could do enough of their contact tracing to say a preponderance of these new cases came from these, episodes. It doesn't mean that's the only factor, which is why I'm hedging a little, but they feel pretty confident from their contact tracing that that's what it came from. And we see it too. We see it. I didn't give the data for the weekend because I had too much else to go through, but we see it in our own inspections over the weekend. And you can see it. Brian asked me a few weeks ago, you can see young people get belligerent when you ask them, oh, could you please put your mask on? Could you please separate in a crowd?
Do we have data on inspections of restaurants or bars or shops or wherever it is
We do. I'll go over that on Wednesday. I should have done it today. But we did our usual hundreds of inspections, and I'll do that properly on Wednesday.
Director Alexander Scott, I've gotten a few reports from Newport and Providence restaurants that they've had workers who have tested positive. Number one, is that something you can confirm? And number two, what's the protocol for a restaurant or any other facility, public facility that has a staff member test positive? Do they have to close? How does that work?
With each situation, we handle it individually, depending on the exposure risk, whether or not someone who had symptoms was actually working, and we have a very extensive involvement with the organization. That type of response happens on a regular basis. So I'm not able to speak specifically to what you're saying in those particular communities, but they are the types of conversations that we are engaging in. From a public health perspective, we often work with the business to be as thorough and as comprehensive as possible while supporting them in maintaining the business that's in place. Safety is first, and then being able to say, how can we do this so that you can continue? The same happens in a school setting. How can we wrap our hands around the people who may have been exposed, make sure that they are able to be quarantined, that they know that they need to monitor, and continue to keep the education going, people coming into school, that type of example. So each situation is handled individually. If it's a smaller place, there may have been more people exposed. There may be more of a need to close down. If it's a larger place, for example, there may be a different response that allows us to be more flexible.
Has the Department of Health shut down any restaurants in Rhode Island for COVID outbreaks among staff members or even patrons?
As of what I know right now, we have not specific to an outbreak of cases.
And what about asymptomatic testing for restaurant workers? Are there any results for that? It's been a couple of weeks since that began.
Yeah, I shared the high level percentage positivity from our asymptomatic testing. It continues to be in the single digit numbers. I can come back and provide more detail about the different job sectors that we have been testing. It is definitely proving to be a very valuable resource for us to get a sense overall from the different sectors, what type of percent positivity exists, and then to be able to reassure those businesses as well that we're seeing single-digit positivity rates. So I'll bring that back, but want to use your question as a way to encourage those high-contact workers that we have made this testing available for to go ahead and get tested. Go to the self-scheduling portal.ri.gov and get tested, and it can be done more than once. We welcome cyclical testing once a week, once every 2 weeks if you've already done it and want to get it done again.
The bottom line is if there's a restaurant open in Rhode Island, patrons should feel comfortable going there.
Absolutely.
Hi, James Bissett, Providence Business News. This question is for Governor Raimondo. Governor, how would you describe the state's enforcement policy on various reopening regulations for businesses? Because it appears to be a soft enforcement with really random checks by state officials on certain businesses with the results being kept between businesses and DBR. So without public transparency on that process, are you concerned that businesses either have reopened or are about to reopen that have been patient and been following guidelines will begin to really apply their own interpretation as to how the rules should apply to them and wait for a random DBR visit?
So it's an excellent question, and I previewed in my comments today that either Wednesday or next week, I'm going to have a lot more to say about enforcement. We have had a very light touch around enforcement, exactly as you said. As I've said so many times, we're not heavy-handed. We want to give you a hand. I think it's time that we start to change that approach now that people know what they need to do and they've had a couple of months to get up and running. And truthfully, my opinion is mostly influenced by hearing from so many restaurant owners and retail operators and gym operators who are following the rules. They're saying, hey, Gov, increase the enforcement because we don't all want to be shut down for a few bad actors. So we are right now, today, tomorrow, over the weekend, working on how exactly do we change our enforcement in order to increase compliance. Okay. So right now we're doing what you say. We have the rules, they're crystal clear, they're online. We're doing lots of random unannounced inspections. If you don't comply, we're asking you to comply. In some instances, we have fined people. But it is, I believe, time to do even more, and we're trying to figure out exactly how to do that.
What would you say is like an approximate percentage of the quote-unquote bad actors, if you will, that have received fines or anything like that up to this point?
Yeah, thanks to the tremendous work of our enforcement team thus far, there have been about 10+% or so of really bad actors that we are doubling down in focusing on. There's a third or so that are doing really, really well. And then another group in between that are in between that we want to continue to work with.
Okay, and Dr. Alexander Scott, this question is for you, because I know before, like in typical instances, like say for example restaurants, you know, the DOH puts out, is pretty transparent as to showing who the violators were with restaurants for basic work conditions of that sort. For this particular case regarding COVID regulations, is there going to be maybe a similar transparency portal set up to show which businesses were in violation of specific regulations going forward, to really highlight, hey, if businesses do this, this is what they were violated with, and this is what can happen to you if you fall under these violations?
Yeah, that excellent question is exactly the type of assessment that the governor just shared that we'll be coming back with, the next level approach to enforcement so that we can really expand the outreach piece and help the public be more a part of the process of helping everyone follow the rules.
Okay, so there's going to be more guidelines issued about that on Wednesday.
Either Wednesday or next week. But we are working on that.
Tell you where I'm coming from, because this is a judgment call. I didn't think it was fair to be heavy-handed out of the gate. This is really hard. Everyone's struggling. It takes a certain amount of creativity to figure out how to comply. And so the approach that we took is everything's on Reopening RI, everything's really clear. We're trying to, every business that calls us gets a call back. Like, we're trying to be a helpful hand for people in the first instance. And also I'm trying to highlight the good actors. So one day last week, I just talked about 4 or 5 businesses that were doing an awesome job. Now that now we're entering phase 3, people have had a couple of months to figure this out. Now I think it's time to turn up the heat a little bit on people who are not complying and doing exactly what you said. Like, a consumer should be able to know, is this a restaurant or a company that's following the rules or not? So I decided to wait a little bit, but now that is exactly where we're going to go.
Is it going to be more of like what's been kind of going on right now, where it's just like random spot checks, or is there going to be...
We're always going to do that.
is there also going to be like an add-on if they receive like certain complaints either by a business owner or maybe customers or anything like that?
Yeah, we're also going to, really expand the number of people we have doing the spot checks. Do you want to say something?
DBR on its website has an opportunity to submit a comment, or the phone number that the governor mentioned is also available. DBR does receive complaints or tips, if you will, and they can even be anonymous on an establishment, and then generally speaking, there will be inspections that follow if it's warranted, or it could be a phone call. It depends upon the specific case, so I think that's responsive to your question.
Secretary Pryor, today is the first time we've heard anything to the effect that there have been actual fines imposed. Can you give us some insight on what that process was, how many businesses were fined, whether they were warned, second warned, or how that process occurred, and then is there an appeal process, or what happens?
This approach may change given the governor's guidance. You've heard her articulate the general approach that we're taking as we enter phase 3, but so far most businesses have received more than one warning, meaning that there was an inspection visit, a second inspection visit, or phone call with the establishment's owner. Commonly, there were even 3 instances of interaction. There's something called a compliance order that is put in place where a business knows that it must comply or there can be consequences, and those consequences can include fines, and they can also include some form of closure if necessary. We hope not to exercise that authority, but it can.
Can you indicate how many businesses made it to the stage of 2 warnings and some sort of further action?
I think we can do that. It would need to be something we follow up upon after this press conference. It's a handful of businesses at this point in time that have received compliance orders.
Was that because, as far as you know anyway, was that because they were willfully non-compliant, or because they simply didn't know how to comply, or didn't have
I could not offer you insight there. Yeah, no problem.
Yeah, Pat Ford, Coalition Radio. Secretary Pryor, I'd like to talk briefly about Tidewater Landing. Fortuitous Partners effectively missed their April and May deadlines. They've now been extended until September. When you analyze the pillars that the development is based on, for example, hotels, according to a June 10 report by McKinsey, in one analysis, hotel revenues may not return to almost its normal status until 2023. Sports stadium construction. While most stadium construction has continued, in-person attendance, the driver for ancillary income, has clearly collapsed. And finally, retail construction, prior to COVID, according to a Moody's report, had sunk to a 2-decade low in the first quarter of 2020. What is the likelihood Fortuitous Partners will receive financing? And critically, in the event of a tax shortfall based on revenues within the TIF district, who will pay the shortfall?
There's a bunch of questions embedded in there, all of them good, by the way, so I'll do my best. I welcome the question about Fortuitous and the Pawtucket project. We've been enormously impressed with the ability of the Fortuitous team to progress all the way through the crisis with their due diligence and fulfilling the municipal hurdles necessary to carry out their economic development project. It's been quite amazing to see that very talented team progress, and quite frankly, working with the governor, Mayor Grebian, continuing with his persistent and effective approach with pursuing this project. So that's what it takes to get a project done. You're right, there are a lot of variables in the world right now as pertains to in-person sports and entertainment and hotel stays. Keep in mind that the project was designed to be nimble in that it includes a residential component, an office component. There's a pedestrian bridge, there are outdoor elements. This is a very creative team that is following closely global events and trends, and we're encouraged that they have the ability to adapt and to, as a result, modify their project. We don't know precisely what the final outcome will be, but I will say that I would not count this one out.
But excuse me, with regard to tax shortfall based on revenues within the TIF district.
The way the deal framework has been articulated to date, the tax is structured as a TIF or a super TIF, tax increment financing. That is to say the tax flow from the project would be captured and pledged back to the project and utilized by the project. So there's, under the current framework, there is no direct subsidy or other mechanism. That's the framework that we continue to pursue.